Today, in this video, we will discuss about pharmacokinetics. Firstly, in this word pharmacokinetics, if we divided it into two syllables, pharmaco and then kinetics, pharmaco means drug and kinetic means movement. So, what is the definition of pharmacokinetics? In simple way, the movement of drug in our body is called pharmacokinetics. Okay, now pharmacokinetics is the study of drug movement in, through, and out of the body. It's called pharmacokinetics, and it also known as ADME study. ADME study means A for absorption, D for distribution, M for metabolism, and E for excretion of the drug. Suppose when we take any medicine or drug in our body, when it goes in our blood circulation, it is called absorption. After absorption, the drug transported through various process into our various organ of our body, it is called distribution. After distribution, the drug molecule changed their nature, it is called metabolism. They changed their nature because of excretion. So excretion is very essential for us. If any drug goes, excretion is required for our body. Otherwise, the drug gives us the toxic effect. Okay, so from absorption, what we can learn? How will it get in? From distribution, where will it go? From metabolism, we can learn how it is broken down. Then excretion, how does it leave? Now, the first parameter of pharmacokinetics, that is absorption. Absorption. Absorption is the movement of drug from its site of administration into the blood circulation. This is called absorption. Absorption occurs through drug transportation. So, what is drug transportation? Drug transportation means drug need to pass through one or more cell membrane to reach their site of action. This is called drug transportation. And drug transportation classified various transport. The first one is passive transport. Passive transport. So what is passive transport? Drug transport in the direction of concentration gradient. Concentration gradient means high concentration to low concentration. High to low concentration. Means, suppose this is A and this is B. Here, in this picture A, the concentration is high, and here the concentration is low. So the movement of the drug occurs from high concentration to low concentration. So high concentration to low concentration. This is called concentration gradient. In passive transport or passive diffusion, drug transport in the direction of concentration gradient. Concentration gradients means high concentration to low concentration. And it also known as downhill transport. Downhill transport. Here the concentration is high and here the concentration is low. The movement of drug is high to low. For this reason, we can say it is also called downhill downhill transport. It is the another name of passive transport or passive diffusion. Then more lipid soluble drug diffuse quickly because of our cell membrane, which is made up of protein lipid protein bilayer. PLP model, according to PLP model. Here, no energy and no carrier required. Then the fourth one is more than 90% drug absorbed by a passive diffusion and follow first order kinetics. Then from where drugs are absorbed in our body. We know there are two kinds of drug. The first one is acidic drug and the another is basic drug. So this is two kind of drugs in nature. Acidic drug is absorbed from acidic atmosphere in our body and basic drug is absorbed from basic atmosphere in our body or basic medium. In our body, acid medium, acidic drug, acid medium, acid medium, and basic drug, basic medium. Acidic drug absorbed from acidic medium. In our body, acidic medium is stomach. So, acidic drug is absorbed in our body from stomach. And basic drug is absorbed from basic medium. In our body, basic medium means small intestine. So, acidic drug is absorbed from stomach, which is acidic medium, and basic drug is absorbed in our body from small intestine from basic medium. Okay, then filtration. Filtration through paracellular space. Absorption is occur through paracellular space. Paracellular space means intracellular space of the cell, and the size of the molecule should be 400 to 600 Dalton. Then specialized transport. The first one is active transport. Active transport, drug movement against concentration gradient. Against concentration gradient. Concentration gradient means high concentration to low concentration. And against concentration gradients means low concentration to high concentration. This is called against concentration gradient. And It is also called uphill transport. Why? Here we can see high concentration, here low concentration. Drug movement is low concentration to high concentration. For this reason, low concentration to high concentration, we need energy. Here we need energy. And it is also called uphill transport. Then energy and carrier required because it is a against concentration gradient. The movement of the drug against concentration gradient. For this reason, we need energy. Energy and carrier required. Energy means here in our body, energy means ATP. Energy means ATP. Then symport or co-transport. Symport means when a drug molecule, suppose it's a drug molecule and a ion or carrier, both goes through in same direction. It is same direction. Same direction. It is called symport. And antipode means the movement of the drug. This is called symport. Then antipode. Antipode means suppose this is drug and this is some kind of ions. The direction of the drug molecule and the ions are in different direction. It is called antipode. And unipode means drug is drug movement is in one way or single molecule in one direction. This is called unipode. Then factor affecting drug absorption. The first one is drug solubility. Solution absorb faster than solid. If the medicine is or is the form of solution, it is absorbed fast than solid. Then concentration of drug. Concentrated solution absorb faster than dilute solution. Then area of absorption surface. The third one is area of absorption surface. More area, faster absorption. Then blood flow. If increase blood flow, reduce absorption. Then empty stomach. Empty stomach. The last one is empty stomach, which increase absorption of drug in our body. This is the total concept of factor affecting drug absorption. In this video, we will discuss the first parameter of pharmacokinetics, that is absorption. This is the total things of absorption. In our next video, we will discuss the second parameter of pharmacokinetics, which is distribution.